Hey baseball players, welcome to the channel. My name is Dr. Andy Johnson, performance physical therapist in Ooltewah, Tennessee, and in this video we're going to go over two main components that baseball players, especially pitchers, need to address in order to avoid shoulder and elbow pain. Check it out. Before we continue, I want to remind you that as much as we love making these videos to help our athletes out, what we love more is the opportunity to get to work with you one-on-one in the clinic to get you back to what you love doing most. So feel free to reach out if you want to work with us. So unfortunately, in my line of work, we get to see the baseball players after they are hurting. They usually come to see us because their shoulder is hurting or their elbow is hurting, a lot of times from pitching. But what if I told you there's a couple things that you can do to really help you to avoid that pain in the first place? So we're seeing a lot of similarities and a lot of similar issues that are underlying when these athletes come to see me. For example, whether they came to me with a shoulder pain, with an elbow pain, or a lot of different injuries that happen in those two areas, a common theme I'm seeing in these athletes are two main things. And that's what we're going to go over today that you guys can start addressing. And the two things are upper spine rotation and then external rotation strength of the shoulder. And we're going to address both of these one by one. I'm going to teach you ways for you to start working on that so that you can get those moving better and being stronger and hopefully prevent some pain with pitching. Okay, so the first common theme we see in our pitchers and baseball players that are coming to us with injury, especially in the shoulder and elbow, is limited upper spine rotation or thoracic rotation. Now, a lot of people don't realize if you don't have mobility there, you end up putting a lot more stress on the muscles down the chain and joints, especially the shoulder and elbow. So we need to make sure we have a normal amount of range of motion with rotation in that upper spine. Check out this video. Jeremy and I kind of describe how you can self-test this to see if you have enough rotation, and then we'll go over ways that you can start doing to try to fix it. All right guys, thoracic spine rotation. We need enough movement in our upper spine. Here's a great test for that. Jeremy's gonna take his hands, put them behind his head, knees and feet together. Now I want you to notice this setup. On the floor I got two PVC pipes at a 90-degree angle, which really when he's got his feet up against it, we're looking at 45 degrees and 45 degrees. So here's the test. He keeps knees, feet together, hands behind the head. He's going to turn to the left as far as he can. This angle through his shoulders and elbows as well as his hip should get to at least in line with his PVC pipe. If he's well short of that here, we know he's stiff with his spine rotation, but if he can get past it, beautiful, he passed the test. Make sure he tests the other side, and then you're moving on. If you have good motion there, perfect. If it's tight, we need to work on it. All right guys, so if you failed the upper spine or thoracic rotation test, we love to utilize breathing to help improve that motion right away. The setup is very similar to the test. Jeremy's gonna put his knees and feet together. He also has the option of crossing the feet if you have a hard time keeping the feet in position. He's still gonna bring the hands up behind the head. And so he was limited with turning to the left, so we're gonna turn to the left as far as he can. He's gonna give me a good deep breath in and out. And then as he let that air out, he's gonna side bend as far as he can, trying to push these ribs out to the side. Another good deep breath in and out. He might even do two of them there. Yes, sir. He's gonna come out of the side bending, rotate a little bit further, and we're gonna repeat that 2 more times for a total of 3 times. He's doing a really good job of making sure we're using that breathing to help us get these ribs loosened up around that upper spine. So you'll go through that idea 3 times, you'll then come out of the rotation and then retest your rotation to that same direction. Does it improve? Give it a shot. So another way I like to work on the upper spine rotation is in a half kneeling position, and we're gonna utilize a short foam roller and a weighted ball. So we're gonna get up close to the wall. This foam roller is kind of my depth finder, my distance from the wall, and I can't let that foam roller fall down during the motion. So I have to keep my knee pressed up against it. We're then gonna hug this weighted ball. I'm gonna take a deep breath in and out. As I let it out, I'm turning. When my in range is found, another deep breath in and out. Rotate a little further, bring it back to starting position. utilizing the weighted ball really helps add some load and stretch to that motion. And of course, you can repeat that process. I really like to rep it a good 5 to 6 times one direction, and then if I was also stiff the other way, you turn around and do it the other way. Okay, so the next common theme or limitation we're seeing in a lot of our injured baseball players is weakness in the external rotation of the shoulder. So external rotation meaning we're rotating the shoulder out. So if I'm doing it by my side, it's here. As a baseball player, obviously we're gonna get a lot of that up here. And so we'll see a lot of weakness in that. And a lot of these players are really surprised when I test them that they are weak, because we're talking really strong pitchers. However, when I test that specific motion, a lot of times they're weak when you compare it to their non-dominant side. And it can be surprising and frustrating to the athlete. Now, it's really hard for yourself to know if you have some weakness there. It's hard to self-test unless you have some sort of dynamometer like the dynamo here. And obviously we do that in the clinic, but if you want to kind of do a quick self-test, an easy way to do that is to take a dumbbell. And my standard is just take a 5-pound dumbbell, and you'll test the dominant side and the non-dominant side both. And the test is just laying on your side. You're gonna put a towel between the arm there. And then all you're gonna do is you're gonna count how many reps you can do this rotation right here by your side. We're not lifting off, we're keeping that towel pinned down, and I'm also not rocking back. How many reps can you do without compensating? So you'll test one side, let's say it's 20 reps, compare that to the other side, and if you see a significant difference there, then you could argue, okay, I probably have some weakness in that external rotation. Now, here's the cool thing, based off EMG studies, the 2 best exercises, you just saw one of them. So if you have weakness, you're gonna utilize that position as an exercise. Now, you may slowly start to go up in weight, because if you can do 20 reps with that 5-pound, maybe you need to go up a little bit heavier where it's in that 8 to 10 rep range with it being challenging. But that is one really good way to start strengthening that muscle group right away, especially as a throwing athlete. So that's exercise number 1. So sideline rotation, again, looks like this. And if I were gonna go a little bit heavier with a 10-pound, it's the same setup, shoulder blades back, rotating up, control it coming down. Because as a throwing athlete, as we're coming forward, we have to be able to control the load. We can't just let it drop. So we're strengthening in that capacity by your side. Now, we also have to remember, when we're throwing a baseball, we're not throwing it here, right? We're up here. So we also need to strengthen that up here in the range that we're throwing in. So another really good way to do that is to get the arm up to a 90-degree plane a little bit. And then we can do similar setup. So we can get in this setup here. So now my arm is up, and then we're going to do the same rotation. So we'll call this starting position, rotate it back, and again, control coming down, using that posterior chain muscle group to control the weight coming down. So now we've strengthened that muscle group a little bit more in the orientation of where the throwing puts us. And so you keep repping that. I usually recommend people, you choose the weight based off the 8 to 10 rep range. So if you could do way more than 10, it's too light. If you can't even get to 8, it's too heavy. So choose your weight accordingly with that, and be willing to progress that over time to get that rotation strength stronger, and really to make the shoulder and elbow a bit more robust and hopefully prevent some injury as a throwing athlete. So in review, if you want to prevent shoulder and elbow injury as a pitcher or throwing athlete, 2 main focuses to start with would be your upper spine rotation, improving your mobility for that, and maximizing your external rotation strength of the shoulder. Once again, guys, thanks for watching. I hope you found this video helpful. If you did, please click the subscribe button and leave a comment below about your experience if you have any questions. Looking forward to hearing from you.